name's Henry Chapman. I'm a researcher at Infegy, and I'm really excited today to walk you through our latest insight brief. This insight brief is how finding medical advice online can backfire, and we'll be using the context of men's hair loss as our example. So when we first talk about hair loss, it's really important that we understand the community that we're talking about. These folks are typically men, which we've reinforced with social data. But what's more interesting is looking at an age histogram, right? These tend to be much younger men, starting around as early as age 15 and going predominantly up to age 35 to 40. But what's more interesting is when you take a qualitative look at how these men are talking about their hair loss. And we can do that with emotions, as shown in figure 2 below. So in figure 2, we see top emotions like anticipation, anger, and disgust, which suggests a pretty vulnerable patient community that, in my opinion, is probably willing to do some extreme things in order to deal with their hair loss. And so that's something that the data is actually going to reinforce, which we'll talk about in just a little bit. But first, let's talk specifically about how people are talking about hair loss. And in order to do this, we'll use topics. Infegy's topics pull out the most important verbs, nouns, and adjectives, which appear within conversational context. And you'll see a lot of these topics deal with the initial discovery phase around hair loss, specifically things like hairline, receding, and even the word noticed, right? And so that's suggesting to us that this is a population that is initially realizing they're having a problem, and they're going to try to do something to try and fix it. So within that context of hair loss, specifically around men, we see a really dramatic rise within two specific treatments. The first one being finasteride, which is depicted in that blue line below, and the next one is minoxidil, commonly known as Rogaine, depicted in that orange line. Both of these saw pretty dramatic post-volume growth over the last 3 years. Minoxidil experienced 40% growth, which is pretty dramatic and remarkable for a product like Rogaine, which has been around for a really long time. But the real story here deals with finasteride, which saw 108% growth in post-volume over the last 3 years. A key explanation for this has to deal with the real surge in advertising around finasteride, specifically from the company Hims. Hims is a health company which helps men with things like erectile dysfunction or hair loss. And I guarantee you, if you spent any time on the New York City subway over the last 3 years, you've definitely seen Hims ads. And this is really common, right? You'll see a pretty big surge in advertising and then a corresponding surge in conversational post volume on platforms like Instagram, Reddit, or TikTok. What was really interesting about finasteride, specifically within the finasteride-related discussion, was its mention of specific dosages. Now, this is something that's pretty different within the health space. And what that means is that normally when we deal with health-related topics, we don't see real mentions of dosages. That's traditionally something that happens between doctors and patients. But within the context of finasteride, we see folks who are talking about specific dosages, like 2.5 milligrams, topical, oral. And that's something that's pretty different and honestly a little alarming, especially when you consider the potentially very serious side effects that you can have if you're taking finasteride, things like sexual dysfunction, breast augmentation, things like that, like things and side effects that nobody wants, especially if you're a man who's exhibiting hair loss. We see a really dramatic sized conversation specifically around these side effects. The positivity around this discussion was really, really low, only 33% positive. And so what that's telling us is folks are worried about hair loss. They're going to the internet to try to understand it, and they're potentially getting dosage information and taking off-label or non-prescribed medications, and then continually going to the internet to deal with those side effects. And so this is something that we find to be pretty alarming, right? Because traditionally the relationship between doctor and patient has been more of a safe one, right? Because if you're taking medication, you'll be under the supervision of a doctor who'll be able to kind of guide you through those side effects. But with this organic post-volume growth and real move to taking these drugs like finasteride without the conversation and without the context of the doctor-patient relationship, it's something that is pretty scary to actually see playing out live on social media. So I hope that was interesting. If you want to read more about our methodology or the rest of our analytical process, definitely check out the link to the insight brief. The link is in our description of this video. Thanks so much and hope to hear from you soon.